I'm excited to talk today about the work that I'm doing at the moment. But just before I sort of jump in to talk about my current study, which is HIV prevention among trans women in Lebanon, I'm going to provide a bit of background in addition to what Ali has talked about so far in terms of sort of how we got to where we are and how this kind of study exists in the context of HIV in the region. So the first half of the 2000s, there was little discourse on HIV prevention in the Middle East and North Africa. And then it wasn't until around 2007 where we kind of started hearing about, a time to act and a window of opportunity and kind of more discourse and concern about what's happening in the region. So in 2007, the Population Reference Bureau published a report, Time to Intervene, Preventing the Spread of HIV in the Middle East and North Africa. And just kind of some things that we learned from that report is, sound bites, low prevalence but not low risk, prevention can avoid an epidemic, and kind of talking about the cost of inaction and what it would mean if prevention does not happen. So at the time in 2007, the known prevalence was 0.1 to 0.2% in the region. And then in 2010, the World Bank put out a report characterizing the HIV/AIDS epidemic in the Middle East and North Africa, time for strategic action. So again, this kind of call to action. And from this report, we learn that despite a fair amount of progress on understanding HIV epidemiology globally, the MENA region is the only region where knowledge of the epidemic continues to be very limited. So this epidemiological report sought to kind of address the dearth of information that we were hearing about. And then in 2012, the World Bank put out another report, Preventing HIV in the Middle East and North Africa, Window of Opportunity to Act, and where at this point we learned that the prevalence has kind of crept up to 0.3%. But this particular report points out that the surveillance of HIV is seriously deficient in the region. So these are kind of best estimates. And we also learned that the prevalence level does not mean that the risk of HIV will remain low in the region, and that timing is crucial, and the window of opportunity that exists must not be wasted if the mistakes of other regions with more advanced stages of the epidemic are to be avoided within the Middle East and North Africa. So I'm going to go kind of quickly so we have time at the end for questions, hopefully. So I was involved in a systematic review that was related to one of those World Bank reports that I just mentioned. And we published a report in 2011 that focused on epidemics among MSM and found that, indeed, there are emerging epidemics among MSM in the region, specifically in Egypt, Yemen, Oman, and Lebanon. And this was also the first effort to kind of point out the fact that, as in other parts of the globe, other regions in the globe, that often trans women and trans populations were kind of conflated inaccurately and kind of thrown in with this MSM category. And so we kind of started to establish this need to separate and distinguish the populations. So all these kind of concerns about the epidemic, and I want to put this slide up again, just to kind of, it's a pretty dramatic graph showing how most of the other regions in the world have been able to decrease the incidence rates, but you see the MENA region on the left. It's pretty dramatic that they've, not been able to kind of curb the new infections. And let's see, so basically in response to these kind of growing concerns, the NIH put out a call for addressing HIV in the Middle East, and I believe 3 R21s were awarded in Syria, Iran, and Lebanon. So at the time, I was living in Lebanon doing dissertation research among women living with HIV. And I met Glenn Wagner, who was the PI of the R21 in Lebanon. And I was involved with consulting on that grant from conceptualizing all the way through to the end of the grant. So we're now working on manuscript development. So again, just to kind of continue with the background of where we came, what we've done so far. So as far as we know, This was the first study in the region to include trans women, specifically as a separate and discrete population. So the study did not conflate these separate categories. It was a mixed methods study, including MSM, male sex workers, and trans women. And each of these three groups were analyzed, recruited, and they were, separately dealt with. So almost three different studies wrapped up into one. So the first phase was the qualitative phase that we published last year, and in that paper we discussed the overlapping threats of trans women's safety in Lebanon that they face, including social and emotional safety, physical, sexual, and financial. One thing to highlight among many things that I could say is just in Lebanon, as well as other countries in the region, this really important, the importance of family role in the culture, and so much so that civil society and NGOs and CBOs often are sort of less developed or less sustainable, less kind of prominent than other settings, which can create this huge gap in trans women's lives who are often rejected from their families and then don't have the safety nets that exist in other settings. So there's a lot of work to be done to meet the needs of trans women in a culturally and comprehensive and relevant way. So the second half of the R21, there were 54 quantitative surveys. Again, this is the among trans women, and so the full data set is currently being analyzed. Actually, I'm working with a global health sciences master's student, Justine McGowan, who's helping us analyze the full data set. And we've got one manuscript under review on the suicide attempts among this population. But the preliminary results based on the first 40 surveys I can share with you, and these are not, some of them are not published yet, and they're obviously not final numbers. But the results suggest high levels of risk for HIV among trans women, 66% condomless receptive anal intercourse, and compared to the MSM results, it was 64 of unprotected anal intercourse. And then we've got 65% sex work, and then high rates of past trauma, depression, anxiety, suicide ideation, and attempts. So for this population, in terms of suicide, it's a really, it's a huge challenge in this community, and the rates within the Lebanese community are similar to other rates globally. So 46% had ever attempted suicide, and that's compared to a 2% prevalence in the Lebanese population. And then in terms of the HIV prevalence rate, 7.5% were HIV positive in the study, and that's compared to trans women throughout the world, a wide range of 11.8 to 39.5, so that's a wide range. But then compared to the general population in Lebanon of 0.1% currently, and then compared to the MSM that we found was 1.5. So much higher risk compared to the MSM. So when we're talking about high-risk populations, trans women are very high risk, and this confirms that also in the context of the Middle East, trans women are also at high risk. Again, these are not, some of these figures are not yet published or finalized. So to address the health disparities among trans women, our next logical step is to understand better trans women's lives. We've sort of barely scratched the surface yet, and there's a lot we need to learn about their lives and the challenges they face in terms of health and safety. So as far as we know, this study is the first to focus solely on the needs of trans women in the Middle East. We're starting a 4-year project among trans women. It's a K, and the aims are to explore the psychosocial and cultural factors that affect trans women's mental health and HIV risk. And then we'll use this data to adopt an existing intervention called Transaction for use in Lebanon. And then we'll assess the feasibility and acceptability of the adapted intervention. So Transaction was an intervention developed by Kathy Reback, who is down in Los Angeles. And she's been running this program for, I think, 2 or 3 decades. It's a peer-delivered individual and group intervention that seeks to build kind of social cohesion and decrease HIV risk. So the study was developed in partnership with MRSA Sexual Health Center, and I can't speak highly enough and sing their praises enough. They were established in 2011, and they provide social, psychological, and medical services to all sexually active people in Lebanon, and that's regardless of age, gender, sexual orientation, in complete confidentiality. So the unique thing about MRSA, a few things actually, they're sort of a standalone clinic, which is not so much the model in Lebanon. It's usually people seek services in sort of a larger hospital or large facilities. And they really emphasize their kind of accepting and friendly atmosphere and non-judgmental, so people can really feel comfortable going for STI testing and other services at MRSA, where they wouldn't necessarily want to go to their family physician, where privacy would be questionable. So they've been widely successful and have kind of been overwhelmed with the numbers that they're seeing and treating and screening there. They're also an ideal partner organization, and I'm thrilled to work with them. Also because, so they'll be the ones that will be implementing the intervention, and so they will already be familiar with how it runs, and if it is shown to be successful, then the sort of sustainability will already kind of be built in, and the translation of results to the field will already be there and ready to go. They're also very committed to the trans community already. They have some programming going on, and they have referral services, and they're very committed to what's going on in the community. So at the moment, we're setting the groundwork for starting phase 1 of the study, which is a qualitative phase of interviews and focus group discussions. I can talk more about this if we have time for questions, but just wanted to give a quick introduction to what is happening in Lebanon in this area. I'm really excited because next month my study manager, who's the person in the middle, is coming for training and to meet with Joanne Keatley at the Center of Excellence in Trans Health. So that'll be a great opportunity. And then it's also really exciting time in Lebanon. So the R21 that I mentioned, the next logical step of that too, there is going to be an intervention project for MSM as well. So timing is really great. There's a lot of opportunity for synergy and awareness raising and dialogue. And so it's also really exciting to be taking action within this window of opportunity that we've been hearing about for such a long time. And I'm also really excited to be working with my colleagues in our group that we've formed, and for the symposium that we're going to be planning for the fall. So last but not least, some acknowledgements. My co-mentors, Colleen Hoff at SFSU, Craig Cohen here, and then my other mentors on MyK, Sassan Abdurrahim in Beirut, Jay Savelius here, Tim Lane here, Kathy Reback, who I mentioned, and Glenn Wagner, both down in LA. Justine McGowan, who's the student that I mentioned, and Ruth Greenblatt is my CFR mentor. And then thank you to the organizers and hosts, Rochelle and Susan, and to Mary for recording this presentation.